Case number one is a 25-year-old male who had returned from a trans-African tour, including Kenya and Sudan. He was suffering from splenomegaly and anaemia. This is a bone marrow trephine. What is the diagnosis? I'll start with some low-power overviews and then zoom into the relevant area that should give you the diagnosis. Case number two is a male of 45 from Sierra Leone, and he had a swelling above the scapula. It was thought it might be an oncho nodule, and the snip skin biopsy was negative. This is a subcutaneous biopsy. What is the diagnosis? Case number three is from a male of 30 from the Democratic Republic of the Congo. He had bleeding oesophageal varices. This is a section from the liver biopsy. What is the diagnosis? Case number four is a skin biopsy from a male of 12 from Liberia. He had several hypopigmented skin lesions. What is the diagnosis? The final case is an axillary lymph node from a 5-year-old Ugandan child with a 2-week history of generalised lymphadenopathy. What is the diagnosis?